Now, let's talk about exceptions and how to approach these with clients. In the words of Steve de Sager, one of the pioneers of solution focused brief therapy, if you do not ask about exceptions and successes, the client will not tell you. After all, what they are concerned about is the problem which drove them to seeking therapy. Utilizing exceptions is an important aspect of SFBT. The questions related to exceptions are based on the idea there are times when the presenting issue or concern is not negatively impacting the individual. By helping the client notice these experiences, it gives them less power. With exceptions, we are exploring times the problem doesn't happen, happens less, happens with less intensity, or doesn't last as long. Remember, exploring and amplifying exceptions can help lead to more times a problem is not occurring. Additionally, as we look at exceptions with the client, look for instances. These are when part of the desired outcome is already occurring in a client's life. For example, if you have a student that is skipping multiple classes but is not skipping their English class, it can be very helpful to explore why that class is the exception. Is it a class they feel confident in? Is the teacher kinder or more engaging? Is the time of the class a better time for them? Do they have more friends in the class? The answers unlocked in this discussion can provide some great ideas for finding successes in attendance in other classes. Another example would be a student that feels shy and does not speak in class or to other students at school. If you're able to explore a time that they did talk more in a social setting or at school, these answers can help the client gain insight so that you can explore as a team to help find solutions for other scenarios. Some common exception questions include: can you think of a time that the problem was not present? When did you feel the happiest? What was it about that day, experience, time that made it different than normal? When is this not a concern? And what are you doing differently in that moment? When do you feel calmer, less shy, less depressed, etc.? Remember that using these questions allow you to work as a team with the client to examine their experience, gain insight, and find some solutions. Therapeutic teamwork is a huge part of SFBT, especially within the exception questions.